A hearty good morning and welcome to the session on fertility options for PCOS. We are glad to have Dr. DHIVYAMBIGAI among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Hello, good morning, on and all. I'm Dr. DHIVYAMBIGAI, consultant fertility specialist at Apollo Fertility, Karapaka. So today I'm going to talk about PCOS and the fertility treatment options for PCOS. To start with, I would like to discuss about what is PCOS, how a PCOS woman would be presenting. So PCOS is polycystic ovarian syndrome, in which we have first and most common presenting complaint is irregular periods. So usually regular periods are once in 21 to 35 days. If anything beyond 35th day, if the frequency is more than once in 35 days, we call it as irregular. So PCOS women generally they present with periods once in 2 months once or 3 months once. Sometimes they don't get periods on their own. Most of the time they take some medications to induce their periods. So this is the one common complaint seen in PCOS women. The next is features of hyperandrogenism, meaning excess male hormone in the body resulting in hirsutism. Hirsutism meaning presence of male pattern of hair growth, like hair growth over the upper lip, chin, and they have excessive hair growth over the arms, and then there will be hair loss on the scalp. So these are and acne, pimples, all those are part of excess male hormones in the body. So PCOS women generally have excessive male hormone. We call this condition as hyperandrogenism. And third thing is when these women with these symptoms of irregular periods and this acne, excessive hair growth over the face, when they are subject to scan, we do see this polycystic appearance of ovaries. Polycystic appearance is just a scan finding. So women with isolated, like just a scan alone showing a polycystic appearance of ovaries, but they don't have any other symptoms like irregular periods or facial hair, then we can't diagnose them as a PCOS. So this one important point I would like to convey in this chat, like just because a scan is showing PCOS, don't be afraid that you are being affected with PCOS. Consult a doctor, get yourself examined, evaluated, and then if the doctor diagnoses PCOS only, then we consider that patient being with PCOS. So these are the symptoms. So what is the incidence? This PCOS has become very common nowadays, and it is actually a lifestyle disease. So the basic problem causing all of these symptoms is hormonal imbalance. So why this hormonal imbalance occurs is because of our lifestyle, like sedentary lifestyle mainly, improper eating habits, choosing eating lots of unhealthy foodstuffs, like mainly fatty rich foods, resulting in excessive weight gain. So whenever there is weight gain acute, like whenever there is rapid increase in the body weight, this hormonal imbalance sets in, leading to all these symptoms of PCOS. So the incidence is like 5 to 10% of Indian women are being affected with PCOS. It is commonly seen in the reproductive age group between 20 to 40 years. So this, since the incidence is very high and affecting the reproductive age group women, these women before marriage they are affected with irregular periods, and after whenever they are planning their family, they do face fertility issues. Fertility issues mainly they have difficulty in conceiving naturally. That is because of these irregular periods. So one basic thing we advise for any newly married couple planning for pregnancy, we advise them about the fertile days, that is the ovulation days, where in which they have to be in contact, that is called timed intercourse, around the time of ovulation to increase their chances of pregnancy. So women with PCOS, we are not able to predict the fertile days or ovulation days because it is like irregular. Irregular in the sense, why it is irregular? Because it is because of lack of ovulation, like anovulation, that is no egg growth or egg release. So that is why the period is not being regular. For a regularly ovulating woman, for example, say the cycle is 28 days, So 28 days, we calculate the cycle day from day 1 of period, that is whenever the bleeding starts, that is considered as day 1. From day 1, in a 28 days woman, usually ovulation occurs in the mid-cycle. So, and after ovulation, 14 days later, if a woman is not pregnant, she'll get her periods. That is the calculation for ovulation time. So if it is 28 days, the ovulation happens on 14th day. And if it is 30 days cycle, the ovulation happens on 16th day. That is how we say, okay, 28 to 30 days cycle, somewhere between 14th to 16th day, the egg release happens. So that is how we advise the woman to be in contact around the ovulation time to get pregnant. So this is a basic, simple, natural method of conceiving. But in PCOS women, we are not able to give a time limit for the ovulation, because ovulation doesn't happen in a regular pattern. So that is the main reason behind infertility, like for having difficulty in conceiving with this PCOS. So usually women with PCOS, the prevalence of fertility issues is like close to 70%. That is very quite high. So say for example, like this PCOS woman, yeah, ovulation is not in a regular pattern. Maybe once in a while they ovulate. So if at all this once in a while ovulation, if they are able to conceive, it's okay. But then if the periods are regularly irregular, like if they don't get regular periods at all, like once in a while in a year, if 1 or 2 periods gets irregular, it is fine. But if it is their pattern only, it's irregular periods, then these are the women who, when they wish to conceive, they require fertility treatments. So when these women come to us for fertility options, treatment options, these are the, I'm going to discuss about what are the various options available. So the first and foremost thing, as I already mentioned, that it is a lifestyle disease where when even in the fertility treatment, we'll start from the basic approach. Like we'll start with the lifestyle modifications. So mainly the overweight, being overweight, we'll check the BMI of the women. If the BMI is on the higher side, then we first advise them to lose weight, reduce their body weight. This reduction in the body weight will be helpful to initiate ovulation process in them. Thereby, the chances of natural pregnancy itself will be high, on the higher side. So this is the first line of treatment in PCOS with fertility issues, that is the weight reduction if they are obese. So this 5 to 10% of the weight loss itself is beneficial to initiate ovulation in them. We have various studies about this obese PCOS and the effect of weight reduction on ovulation. So it is well proven that so these weight reduction, like how to achieve weight reduction through their diet modification and regular exercise. So this regular exercise, we advise at least minimum 30 minutes workouts in any form, running, jogging, or any gym activities, or dancing, swimming, whatever. So any sort of physical activity, 30 minutes in a day, at least 5 days in a week should be targeted. And diet wise, avoiding fatty rich foods and choose the healthy fat. So for healthy fats are like available in olive oil, and we have this nuts and seeds. And other than that, in animal proteins also, better to avoid fatty rich meat, like the red meat. All of those can be avoided, and preferably they can choose these seafoods and country chicken in the non-veg source. And other than that, consuming fresh fruits and vegetables. These will be helpful because they are rich in minerals, nutrients, and antioxidants. So all these things, all these diet changes would be beneficial to initiate a ovulation in a natural way. If suppose this first line of lifestyle changes is not helping them, then we'll start with the second line of treatment, that is the medical management. So PCOS women will be first evaluated with hormonal profile, which we prefer to do it on day 2 of periods. And this, along with the hormonal profile for the ovulation, apart from this, we do this other hormonal tests like the thyroid function, serum prolactin. Serum prolactin is a milk secreting hormone, which is sometimes it's being elevated in PCOS women compared to a normal woman. So this high prolactin again will be inhibiting the ovulation. Like high prolactin levels will interfere with ovulation, causing anovulation, that is absence of ovulation. So these PCOS women will be evaluated for a hormonal profile, that is the ovulation related hormones, as well as this thyroid profile and prolactin. And we do this AMH, anti-Mullerian hormone. Anti-Mullerian hormone is a blood test which gives an idea about the ovarian reserve. PCOS women are generally seen with higher AMH. They have a AMH above the cutoff level. They have high levels of AMH. So these through this hormonal measurements, we sort out our treatment plan. So the main problem here is absence of egg growth. So our treatment will be targeted to initiate the egg growth, that is ovulation process. So first thing is the simple basic treatment is giving them ovulation induction drugs, that is medications that in the tablet form. We have two commonly widely used medications. One is clomiphene and the other one is letrozole. So these are the tablets. We start from day 2 or day 3 of their periods and we give them for 5 days. And then we'll stop the tablets and then we'll reassess them on day 9 of the periods. This is the basic treatment we start. So after 5 days of ovulation induction drugs, they'll be called for follicular study. Follicular study is nothing but a egg growth scan. It is an internal scan. It is done transvaginally. It's an ultrasound scan where we assess the response to the tablets given through the measurement of the follicle. So if the woman is responding, then we do this follicular monitoring and we track the ovulation, and we'll be able to tell the couple when the woman is going to ovulate, and then by then they can try naturally. This is called ovulation induction and timed intercourse. So this is the basic basic first line treatment for PCOS women. So if suppose the tablets are not responding, here again whenever you're using the tablets, there are two sets of response. One is there are actually three sets of response. One is normal response, which is the desired response. Like when we give the tablet, there will be 1 or 2 follicular growth, and then they ovulate, and then they conceive. This is a normal, whatever desired response. There could be other 2 responses like no response. Sometimes these women are very resistant for ovulation. In spite of taking the tablets also, there may not be egg growth. So in spite of taking the tablets, still they end up in anovulation. That is called no response, like resistance. And the third one is hyper response. What we desire for a natural pregnancy is 1 or 2 eggs in a cycle. But if there is a hyper response, meaning if there are more than 2, like 3, 4 follicles, or sometimes we do see 5 follicles also. If it is more than 2 follicular growth in a cycle, then we call it as hyper response, which case we sometimes have to cancel the cycle to prevent any chances of multiple pregnancies, like triplets, quadruplets, like that. Up to twins is okay. So these are the challenges in treating the PCOS woman. So only few percentage of women will fall under the normal response. Other than that, they may end up in no response or they end up in hyper response. Both ways, it is not very successful. So these are the challenges we encounter in PCOS women. So if it is on the other 2 extremes, like either hyper response or low response, then we have to alter the treatment methods. So in cases of no response, we step up the treatment. Sometimes we do give injections, but we use it in a very low dose, and we use it very cautiously because the chances of hyperstimulation, that hyper response in these PCOS women, especially seen in women with high AMH. So after our assessment, if we found to know that PCOS women with high AMH, will be extremely cautious in using these injectable medications, that is hormonal injections to promote ovulation. So these are the methods we follow. If suppose this natural method of just the tablets or the minimal dose of injection is not working, we have one method called, like, we assess the ovarian volume in the scan. If the volume is on the higher side and if the appearance of the ovary, we see lots of stroma in the ovary, then there is an option called laparoscopic ovarian drilling. Nowadays, we don't follow this laparoscopic ovarian drilling on a routine basis. It is reserved for it is reserved for candidates who are highly resistant to the routine medications we already described. So laparoscopic ovarian drilling is not the first line of treatment. We don't prefer to do it for every woman. Only in few selected patients who really require this laparoscopic ovarian drilling. After explaining the pros and cons, will be deciding. So it is only a second line of management. Here in this drilling, we use this monopolar electrocautery current to drill the ovaries. Maximum 4 drilling will be given on both the ovaries, and this is mainly to reduce the high male hormones in the body, that is hyperandrogenism. This ovarian drilling will be helpful to reduce the high male hormones in the body, thereby the ovulation process sets in. So this is another method. And if suppose all of this is not working, and if sometimes we do see PCOS women with coexisting other reasons for fertility, like if suppose the male partner has got low sperm count, or if there are any tubal patency, like we assess the tubal patency through a dye test. If suppose the tubes are not looking normal or any tubal blocks identified, then in that case, we step up the treatment with IVF, in vitro fertilization, bar ICSI, intracytoplasmic sperm injection. So this is how we follow a systematic stepwise approach in treating the PCOS women. So IVF for ICSI will be the last resort if the PCOS woman, in a PCOS woman, if all other factors are normal, if the male factor is normal, tubes are okay, then we would try step by step in this way. If it is not successful, then then only it will be taken for IVF cycle. Again, in IVF cycle also, we do have this risk of ovarian hyperstimulation syndrome. We call it as OHSS, commonly seen in PCOS women with high AMH. So that extra precaution care will be given to these PCOS women during their fertility treatment. So these are the various options. So my take-home message would be for women with PCOS looking for fertility options. First and foremost thing is their lifestyle change. That would be definitely helpful, either to conceive naturally, or if suppose even after doing the lifestyle modification, if they are not able to conceive naturally and if they have to come for a higher treatment like ovulation induction or IVF, this weight reduction would be definitely helpful to achieve a successful treatment outcome. That is one point I would like to convey. So if at all their weight is on the higher side, first thing what they have to target is their weight reduction, and they do have all of these options. So women with PCOS need not feel like very bad about their condition. We have various treatment options for PCOS. Through one or the other way, they'll be able to conceive successfully. So what they have to have, like the determination, perseverance, and healthy lifestyle. This would be helpful for them to achieve a successful pregnancy. And apart from this pregnancy, this PCOS impact on fertility doesn't stop with achieving a pregnancy alone. During pregnancy also, these are the women who are prone to develop some complications like gestational diabetes, gestational hypertension. All of those can occur during pregnancy. So once the PCOS woman gets pregnant, we'll be watching out for all these things. We'll be regularly assessing their blood pressure and their blood sugar levels to detect if at all they develop any of these, to control them and to give a healthy baby in their hands. So and this so these are the options and how the treatment goes on and what are the things to be expected during pregnancy in women with PCOS. Thank you all for attending this session.